She was born and raised on the north side of Youngstown and went to school at Ursuline and just really knows the lay of the land about Youngstown. At one point I remember her telling me that she feels like she's a connector. So she reaches out, she knows people, and she connects them back to us at Mercy with resources or with whatever they might need.
And we started the Healthy Homes, Healthy Families Coalition, and it to really encompass more than just Youngstown City Schools. And we focus on asthma. We just did a whole campaign on lead prevention, lead poisoning prevention, and lead testing. Again, bringing the Mercy Health lead poisoning prevention program. And so, like, Bridget and I just kind of continue to look on new things to tackle when it comes to helping our families.
So one of the things that I really appreciate about Bridget is that she's working on solving a really important problem, and that is improving the health of people in the Mahoning Valley. And her program, the Fruit and Vegetable Prescription Program, started off very small. It was serving maybe about 100 patients, and it was working really well. And so Bridget advocated for that program. She got funding for that program. She figured out how to expand that program. She figured out what partners she needed to bring on board. So it went from serving 100 people at a farmer's market right at St. Elizabeth Hospital, and now it's serving 750 people at farmers markets across the Mahoning Valley.
One of the other things that Bridget has done for us in recent years is she was a founding member of the faculty for the RISEN program. So our RISEN program stands for Reinvesting in Spirituality in Our Networks. And so it's a program for us to help our staff, employees of Mercy Health, to explore their own spirituality and how they can bring their true selves to the work that they do. And Bridget was just perfect to help us as a faculty member because she has that same essence within herself. I think she brings that spirituality, that spirit of care and compassion to people. She also organizes and plans our Women in Touch programs, our Project Connect, where we collaborate to help bring people who are homeless or near homeless and bringing them resources into one event so that they can learn about all the resources that are available for them.
She's thought of very highly, and I think part of the reason for that is, like you were saying, she doesn't need to take credit for the work that she does. So she's running a program that's helping thousands of people, but she's not out selling herself as that kind of person.
You know, Bridget, anything that's going to benefit the people, I think, of the mission of Mercy Health, and she really lives that out day to day. I always laugh because she's always talking about all these different nuns. I'm like, how many Humility Mary nuns do you know? So it's like, but she's been around a long time, you know, and she's made it a point to spend time out the villa and get to know the nuns. And, you know, they were a big part of Mercy Health back in the day, and she just has that passion and love and concern and just wants to do good for our community.
You know, the market at the B&O really is a sight to see. I was involved in planning it, but I had never witnessed the market, and I'll never forget the first market when people started arriving by the dozens, some in wheelchairs with walkers, some people with oxygen tanks, bringing them to the market. It's people who really, truly need the assistance, and it truly does make a difference.
I think Bridget really exemplifies the spirit and the mission of the Sisters of Humility Mary and also of Mercy Health. And she just brings that spirit of caring and compassion out into the community for us in just a very special way.
Bridget, congratulations on receiving this year's Continuing the Legacy Award. We are humbled by the service that you provide to Mercy Health and to our patients and to those that you serve in the community. Congratulations.